Hello and welcome to all the participants of this session on IEC under NLEP. My name is Nikita Serra and I work as the Head of Advocacy and Communication with the Leprosy Mission Trust India. Well, the session, as most of you know, is on IEC. What is IEC? IEC stands for Information Education and Communication. The National Leprosy Control Program traditionally included health education approach as a way of improving knowledge on leprosy. The term IEC was originally conceptualized by Family Planning Program and gradually adopted by the other health programs. So why IEC? This is the most important question of today's session. The reason why IEC is really important is that raising awareness is the most crucial and the critical first step on embarking for any public health campaign. Without awareness, people can be misinformed, misled, or even completely ignorant of the health challenges they face. Increased awareness and promotion of community participation, including people affected by leprosy, in developing IEC materials and in taking it forward, executing it, will result in stopping transmission and reducing stigma. Let's look at what IEC aims to. The aim of IEC is disease control, completely stopping and minimizing transmission and bringing about behavior change. How do we do this through? We do it by giving a lot of information on the signs and the symptoms of leprosy, busting myths, providing correct information, encouraging early detection, and community participation and ownership. Now we will deeply look into the definition of IEC. Information refers to the generation and dissemination of general and technical information, facts, and issues. What is the outcome of this? There would be improved knowledge about leprosy and its signs and its consequences. What does education refer to? Education refers to the process of facilitating learning to empower and enable audiences to make correct decisions. How does that help? The people affected by leprosy or the Aam Janta or the general community, as we call it, will be able to recognize the signs and symptoms and violation of human rights and report at the correct time. Communication is always evidence-based. So we look at communication that's evidence-based, which will help increase knowledge and social change and influence the community to adopt and maintain desirable attitude and behavior, thus reducing discrimination. Now from this side onwards, we are going to look at some of the most important and crucial ways of developing IEC materials. Now for developing IEC materials, there is no right way or there is no wrong way. But yes, there are some really important ways on which you have to very closely pay attention while you are developing IEC materials. Now there is something known as the P method or the P approach, and so the first one is that we must inquire. We must completely map out what are the most important components that we want to design our IEC material about, what is the focus of the materials, whether it's going to be about stigma or it's going to be about early detection or about early reporting. We have to be very sure about the particular state that we are in, after doing a thorough mapping, what is the real need over there, what kind of materials are really required. And once we have developed and inquired into that, we have to further work on designing a strategy. Designing a strategy is based on a lot of components which we are going to see ahead. What kind of media is there, what kind of language do people understand, what do people wear over there in that particular state, and then we are going to create a lot of IEC materials, and then the most important aspect is test it. We are going to test each and every material, so that's known as a pre-test. We are going to pre-test that, and then we are going to mobilize and execute this IEC campaign, or we are going to distribute the IEC materials in the community and going to monitor. So if we are doing it on early detection, we are going to monitor how many people are coming to our PHCs for early reporting. If the whole IEC strategy is around stigma and discrimination, we will be monitoring about how many people are reporting any cases of violation of human rights, or how many people are accessing their rights and schemes and benefits. And then finally, we are going to evaluate the whole program to see how it's evolving. And once we evaluate the program, at this point of time, we can redesign it and we can evolve it further. The next most important step is the target audience segmentation. So this is a step that we need to be doing after doing a little inquiry before designing the material. So there are a couple of components on which we do the target audience segmentation. Now India, as it is a very, very large country with a whole range of demographics over here. So we look at the geographic aspect of it, we look at the behavioral patterns. We then divide the audience based on the social graphics, and then the psychographic and the demographic. Why is IEC needed under NLEP? Some of the most important reasons why IEC is needed under NLEP are delayed reporting, poor case holding, continued transmission, underutilization of services, misleading information and advices, no community participation, stigma and discrimination, and then of course there is a lot of participation restrictions, social and religions, and then no support from the family and the members, loss of occupation and disability and livelihood. Well, now we are going to look at the objective of NLEP. As many of you are already aware that NLEP has several objectives under it. Some of them are early detection, complete transmission of new leprosy cases. But the ones that we are looking at is information and education and communication, activities in community to improve self-reporting to primary health centers and reduction of stigma. What currently does NLEP have as its existing materials? Let's have a look at them. So when you go to the website on NLEP, I don't know how many of you have seen the website, but the link is mentioned below and you must have a look at the NLEP website to get some really good resources. Some of the resources and the existing materials on the website are behavior change communication strategy. There's a guideline on reduction on stigma and discrimination against persons affected by leprosy. There's a strategic framework for reduction of stigma and discrimination, shaping community participation, and there's an operational guideline on sparse leprosy awareness campaigns. So now that we've looked into the process of developing IEC materials, what's next? How do we take it forward? So the other very crucial aspect is what are the kinds of media that are available for us to take our IEC forward. Now, in today's day and age, we have a whole variety of media. Any kind of media which can reach globally in a matter of few minutes, or it can reach hard to reach areas, people in dark media areas. So now we absolutely have no excuses. Now that you've identified your target audience, you've developed your IEC materials, and you know what's the process ahead, you've pre-tested it, now you look for media. So you either partner with a media agency, or you can yourself go ahead and look at the different media that you can take your IEC material on. Now, some of the media that are available to us is of course the print media, which everybody knows. There's written and printed form of communication, which is like newspapers, annual reports, newsletters, bulletins, flip books, which ASHA workers use, posters, leaflets, banners and backdrops and hoardings on road. There's no dearth of such kind of material. Then widely watched media type is also electronic media. For example, the radio or the film or television or documentary films or any kind of promotional videos. Then you have cyber or new media, which is known as the new media, which has websites, YouTube, Facebook, Twitter, blogs, Instagram, Google, and of course the most important one, WhatsApp. Because we find, and post-pandemic, we've been able to do so much of communication across India using the media of WhatsApp. And then of course traditional media. So we can reach out areas which have absolutely no other form of media through Nukkad Natak or puppet shows or magic shows, which very well carry the message across. So out of all the IEC, when we are developing IEC, we really need to identify what is the desired action that we are looking at. There has to be a desired action with each and every IEC that is being designed. Some of the desired action could be early detection and treatment, some could be improved health-seeking behavior, then it could be improved access to health services, improved healthcare services, and perception of leprosy and discrimination kind of changes and reduce, and there's of course reduced internal stigma. Now what you look is at the strategic plan of IEC activities district wise. So if you look at the various columns, you will see the first column is about the serial number, the next is objective, then it's target groups, it's activities, the various kind of communication methods that you're going to be using, what is the media type that you're going to be using, then the message has to be identified over here. You develop and then do a pilot test. What is the expected outcome? The expected outcome has to be very clearly articulated. What are the materials that are required for taking this forward, and what will be the frequency of dissemination? You need to identify all this and put it in the framework over here. Okay, so now while developing IEC material, there are some really other important things to keep in mind. Most of the IEC materials will be having photographs or videos or some form of the imagery. So we should be absolutely careful about the following points. You should always take permission and explain in advance to tell a person affected by leprosy in any kind of setting, whether it's a training program or you're shooting in the hospital, but you must explain and tell them about the related audiences. For group photographs, each and every person in the group should give their permission and their consent to be photographed. If the person is minor, the parents or the guardian's permission has to be sought. Use photos and images that portray the reality of lives of people affected by leprosy. Use them with a great deal of sensitivity and respect for the dignity. Use the photos in the true context, and if a person has disability, ask them if they might like the disability to be portrayed, because not every person likes the disability to be portrayed. And once you have spoken to them, you must confirm on preferably a written document, take a written consent if they are giving their permission to be photographed. And any kind of images that are used in the IEC material should not reinforce negative imagery at all. Many of you are already aware that NLEP in 2018 launched a very large and massive media campaign of Sapna Hai Kushmukh Bharat Ka, and that was the tagline, Kyunki Sapna Hai Kushmukh Bharat Ka. In September 2018, the Supreme Court gave a certain directive for elimination of discrimination and promoting inclusion. They appeal, and the directive was to all the states and the districts that they must do a lot of awareness raising, preferably in the campaign mode at all levels, especially at the Gram Panchayat level. They should telecast awareness films, and especially at prime time, telecast programs on All India Radio and Doordarshan, discontinue use of frightening images, and use positive stories of people who are cured. And last of all, always make sure that you use positive stories of people who have been cured. And with this, I wish you all the very best as you develop your IEC materials and as you implement it and execute it. I'm always there and I can be reached out. My email ID is below. Remember that IEC is only useful when it's understood, and communication works for those who work for it. Thank you so much.